You're listening to The Health Debt to Americans, Missileers, and Missile Maintainers, a Pulitzer Center webinar. Today, I am with Tom Novelli, who's a reporter for military.com. He focuses on coverage of the Air Force and Space Force. He's previously covered veterans, military bases, and federal politics in South Carolina for the Post and Courier, where he was part of the reporting team for Rising Waters, which is a project that examined climate-driven flooding and was a finalist for the Pulitzer Prize. Bill Burich is the director and volunteer at the Torchlight Initiative, which is a non-government organization composed of current and former Air Force ICBM community members and their families. And finally, our moderator today is Susan Ferriss. Susan is a Pulitzer Center senior editor who is an award-winning foreign correspondent in Latin America for many years. She's a book author, a filmmaker, and an investigative reporter. As a newspaper reporter, she investigated toxic military waste at a former major military installation, Fort Ord in California. Thank you all for being here today. Susan, I'm going to turn it over to you, and I'm going to drop those links in the chat. So thank you.
Hi, everybody. Thank you, Ethan. And thank you, Bill and Tom, for joining us and for the incredible work that you're doing to look into the plight, the struggle of missileers, the maintenance workers, and their families. Just a little note, I'm a military brat, and one of my father was a career Air Force. He was a colonel and he was a pilot, and one of his missions was to fly the North Pacific and look for gathering suspected nuclear explosions by the Soviet Union and gather particles. And I asked him about that and later on in his life, and he said, well, it was our mission. I asked about the risks, and the answer was it was our mission. I will say he did, when I reported on Fort Ord and military waste, he did defend my reporting to his golfing buddies at Fort Ord because he used to play golf there. And so I began to understand more the struggles that service members and vets have talking about these issues. So I'd like to start off, Tom, could you tell us about how you got interested in this story, writing for military.com?
Absolutely. First off, I just want to thank you for putting this event together. Thanks so much to the Pulitzer Center for your support on this as well, on this important topic. I'm the Air Force and Space Force reporter for military.com, and truly I can't think of a story that was an example of all the intersections of the Air Force, the Space Force, and the ongoing struggle that service members and veterans have when it comes to toxic exposure. This was all wrapped together. I first became aware of this story early last year. On social media, there was some information that was being spread called the Malmstrom Initiative. And it was a slide deck that was pointing out cancer concerns among missileers who had served at Malmstrom Air Force Base in Montana. At the time that I discovered that, I was living in Colorado. So I was living out west. And I've always had a fascination with the American West as a place. And having my specialty being reporting on the military, I wanted to dive into this issue because America's intercontinental ballistic missile bases are located mostly throughout the Great American West in the Midwest, in Wyoming, in Montana, and locations like this. And so I wanted to dive into this issue, and also just because not much is known publicly about missileers and missile maintainers and this job and the work they do. It's such a unique job within the Air Force. And how this became a Space Force issue and how this initially started was that Malmstrom Initiative slide deck was spread by a current Space Force officer. Many Air Force missileers and those that worked with intercontinental ballistic missiles transferred over to the Space Force when that was created as a service branch in the 2019s, 2020. And so this was an overlap for the Space Force, and this was a key issue for the Space Force because so many of their officers had served at these intercontinental ballistic missile bases, and now there was a warning of potential health and cancer concerns among their officer corps, and that the Air Force has so many veterans from these bases as well. So I was curious about this story because it was this intersection of the Air Force, the Space Force, veterans health, the American West, and I felt like there was a lot to dive into. Only to find out that as we dug into this story, this was not the first time that red flags had been raised about these health concerns, that there had been prior warning signs in the 2000s, in the 1990s, in the 1970s. And I think there was just so much to unpack with it as a result of all of that.
Thanks, Tom. Bill, could you tell us about the Torchlight Initiative and the intersection it has with the work that Tom's been doing?
Absolutely. Thank you, Susan, for hosting this. And before I get into my initial comments here, I want to thank you as well in recognition of your service as well as part of the military family. So, at the Torchlight Initiative, we believe that families are a huge piece of the service members' service, while they're in service and then also, after service as well. So thank you very much for that. And thank you for having me here today and inviting us from the Torchlight to come here to talk. Torchlight Initiative is a very, very important organization for me personally. Very, very passionate about the Torchlight Initiative. We are here to provide advocacy, to provide support to our members, missileers, security forces, missile maintainers, folks that are involved in the missile community, to really provide advocacy, for testing, provide advocacy for studies that go into what could be causing some of these toxic exposures and also these illnesses that we all seem to have moving forward. So from our perspective, as an initiative, this really comes back to kind of some of those core values that we have of family and about taking care of our military family, being there to help advocate for them, also to represent them in terms of getting the word out about this so people don't have to be alone and face some of these challenges that they might be facing from a health perspective alone. So that's really what our initiative is all about. It is a volunteer group. We're a very, very small nonprofit organization, but I think we have a powerful message, and we really focus on trying to help our community members.
Thank you, Bill. Tom, maybe you can sum up for people really and quickly the threats that have been discovered over the years. What could possibly be causing these cancers? What are the potential links that these service members have faced for years?
Absolutely. I think I'm going to start off just quickly by summarizing just what is a missileer and what is this job for those that are unaware of it. So America has intercontinental ballistic missiles, and they're located at military bases throughout the American West, American Midwest. Now, a missileer is an officer, often early in their career, who goes on alert, as it's called. So what they're located in what is called a launch control center, which is under the ground about 60 feet or so, and they are there monitoring the America's nuclear missile forces. Now, these facilities themselves were made during the Cold War era, and they were made with substances that have been recognized as toxic dangers, carcinogens, things that can be linked to cancer and other serious health illnesses. So this is where it's really interesting. And then with those nuclear missiles as well, there's enlisted nuclear missile maintainers who are there making sure that the electronics are working as they should, that the missile is ready to fire at a minute's notice. And this job is a 24/7 around the clock job. So these capsules where these missileers they're living there and working there, sometimes for days at a time, and they're located in these areas. Now, these carcinogens can range from a variety of things that the Air Force has identified in the past, and that's asbestos, radon, something known as PCBs, polychlorinated biphenyls. I hope I pronounced that correctly, but this is a waxy residue surface that's seen in electrical components. Now, all of these things have been linked to potential health issues, and living and working in these conditions, these missileers were often exposed to these things, sometimes knowingly, sometimes unknowingly. But the main issue here too is that maintainers have been working around toxic substances like sodium chromate, for example, things that are linked to other serious health aspects and cancers. And those are all a part of these Cold War era facilities and kind of Cold War era technology that exists around maintaining America's nuclear missiles. So it's in the exposure to these things that missileers have found out that they've gotten sick and have found health concerns, some at a much more rapid pace than the American population. Others haven't found out until they were well removed from the Air Force. And I think that's what also makes this story so wide ranging, is that it encapsulates generations of missileers and missile maintainers, those that served in the late 70s, early 80s, all the way to those who've served as recently as the 2000s, and even those who have just recently separated from service.
Right. And Bill, maybe you could talk about the kinds of stories that are very moving and upsetting that are on your website for Torchlight, the people you've talked to in your community. If you can give people a sense of not just the struggle with the illnesses, but with obtaining treatment and recognition.
Sure, absolutely. So, I'll say too, I'm a retired Air Force and Space Force officer. So I was in the Air Force for the first part of my career as a missileer, and then I switched over to space operations within the Air Force, and then did cross commission over to the Space Force, and then recently retired. So to me, this is a very passionate topic, a very passionate subject for that, and it affects a number of close friends of mine. For that. And before I answer that question, or as I answer that question, let me tell you a little bit about kind of the genesis of my journey with Torchlight, how I got involved with the program. Again, I mentioned being prior military. We stay in touch throughout our community, social media, et cetera. And one of the things, the topics that started to come up recently was folks coming down with different types of health issues and illnesses, which seemed a little bit abnormal given our age, given our fitness levels, being in the service, in the military, having those fitness standards. It seemed a little bit anomalous, right? It was very surprising. And then some of the things that people were coming down with, non-Hodgkin's lymphoma was a big one, a blood cancer, relatively rare, leukemia, brain cancers, and then other issues, other autoimmune issues, other thyroid issues. Really kind of started to, kind of be a bellwether, I think, for a lot of us of saying, hey, not only do we know these folks, but these are close friends. These are people we served with. So, I think that's how it really started, was this kind of groundswell of folks saying, hey, I know so-and-so, or so-and-so just passed away. How can we help? Things of that nature. So it was very, very grassroots. And that's really, again, how the initiative really, really started and continues to be today. My personal experience with it, I ran into one of my buddies. I had heard that he was sick, had a chance meeting with him right after I'd heard the news, and I was just talking to him about that. And I talked to him, and, I was like, hey, what's the prognosis look like for you? What's a treatment path? How are you doing? How's the family? And I'll never forget, he looked me, right in the eye and said, Bill, I'm not going to survive this. This is terminal. And, it was in that moment that, it really hit me, just how impactful this is to, his family, the community, to all of us, and how this could be any one of us potentially. So, so from that standpoint, we got together then as a group of friends, and really just started saying, hey, how can we help? How can we help other people? How can we get together, advocate for some studies into this to see, is there a connection, to the ICBM community? Is there a connection to where we serve? Really asking some very, very basic questions and looking for advocacy there. And that's really how the initiative itself really took off and really started. And then, amongst that groundswell, we also encourage folks to register. We create a website, and we have that website up. It's torchlightinitiative.org. So you can go to that. If there's any missileers out there who are affected or have health concerns, they can go to that, and they can go register, and they can share with us voluntarily what's going on, with their health situation, in terms of if they have any kind of cancers or any kind of health issues that they're concerned with and think might be related to missile operations. So, that really became the genesis of the Torchlight Initiative. And then as we worked together with the registry, we started seeing more and more names come in. On the actual webpage itself, you'll see a number of stories of former missileers who shared very openly their very personal struggles that they have with their illnesses, some of the struggles that they had in terms of getting treatments, some of the struggles that they had just dealing with the realities of their health situation and wondering where that came from. So, again, from an initiative standpoint, then, one of our big focus areas is to help tell their stories, to tell the stories of these people, but then also to rally around them, rally around their families, rally around the community to really start advocating for finding out what's going on with that with the community and with the conditions that might be out there. So the advocacy then goes right to some of our big strategy elements, which includes advocating for increased studies into what could be causing this to see if we can identify any kind of root causes, and then also advocacy for testing, for looking for that preventative medicine piece, probably much earlier than the normal person, since we're seeing a lot of these incidences happen earlier than expected with the general public. So that becomes a big piece of that, because the idea is if we can catch this earlier, catch this sooner, maybe we have better options, right? There may be certain cancers that will be terminal, but maybe we can help with quality of life and help improve longevity. Maybe we can cure the cancers themselves in those individuals, depending on what they have or some of those situations for that. So that's a really big piece of what we're doing. We have also reached out significantly to other veteran organizations who are looking into cancers among their communities as well. And so, we took a lot of those pieces from their strategy elements and really brought those into the Torchlight Initiative for that. So, again, going back to our themes of taking care of people, taking care of families, that's really what's, a key cornerstone to what our initiative is all about. And then advocating for those studies to try and figure out causation for what that might be or could be for that. But bottom line, taking care of people and taking care of the families.
Thank you, Bill. So important, and everybody should be really concerned about this. These are our veterans. Tom, could you talk about more, speaking of studies and solutions, looking for solutions and the need for more studies? There have been studies over the years. Maybe you could talk about your reporting process, which I think would really benefit a lot of people who are journalists and non-journalists to understand what you undertook as a reporter to document not just the stories of the people, but what institutional response has been over the years.
Yeah, absolutely. I think to Bill's point, the missileer community is, and those that have worked with intercontinental ballistic missiles, is one that I've never seen a community so strong and so supportive of one another. And truly, they were key. The people were key to making the story work and unlocking what we needed to investigate, and also helping us provide that paper trail as well as their personal stories that helped us link all of this together. When we started diving into this issue, the first thing is we knew we needed to talk to people to see what has been done in the past, how long has this issue existed. So organizations like Torchlight helped us, because we reached out to them and said, we want to connect with people and we want to hear what their stories are. And immediately, I want to say when I sent out that email, my phone seemingly rang off the hook for about 2 months. I was constantly picking up the phone, speaking with missileers from all different generations, and those who, some of them had been diagnosed with cancer, some of them had ongoing health concerns, some of them just wanted to know more. But the one thing that I found was the common thread among all these conversations was that the concerns about occupational health and safety had existed continuously among these generations. There had been these concerns, whether it was water cooler talk at a base saying, hey, did you hear that so-and-so got sick? Or, do we believe that this substance in our launch control centers or our launch facilities are getting us sick? It had been talked about. It wasn't something that caught them out of the blue. So I want to take this back to really to 1962. So 1962 with the intercontinental ballistic missiles. I'm going to highlight kind of one substance, and because I think it's a good through line as we talk about these studies, and that's PCBs, or polychlorinated biphenyls. So this is something that had been, since the 60s, utilized in the intercontinental ballistic missile facilities and used as a substance. So there really wasn't a lot of concern about that until 1976, when there had been more studies and research, and the Toxic Substances Control Act is passed, outlawing a whole bunch of chemicals and substances, many of which had been located or utilized within the missileer career field and at these military bases, PCBs being one of them. So it's 1976, and PCBs are pointed out as a clear problem, as a clear carcinogen. Then let's take it back 2 decades. So the flag had been raised that this substance is a concern, and that there's a wide variety of concerns. In 1994, the Government Accountability Office puts out a report looking at the military's response to the Toxic Substances Control Act, only to find that many of the services are not accounting for these substances, are not properly remediating these substances. And even in the Air Force cases, in 1991, they just stopped collecting a lot of the data on these substances and how they were being inventoried, which is already, a kind of a red flag, because it's nearly 2 decades since this has been addressed as toxic substances that exist at these bases, and the service is not properly accounting for where they're located. So this kind of boils up in 2001, where a occupational study is commissioned because 3 missileers at Malmstrom are diagnosed with lymphoma. And so they look into this, and the ultimate finding is that everything is, quote, safe and healthy, that there isn't enough to consider probing as they see this. In 2003, a memo was pitched for the idea of a longer ranging health study, saying, hey, there might actually be some concerns here. Maybe we want to dive in and look into a larger health study about this. That never came to fruition. So then it comes into 2005, where they look at these claims again. The Air Force is looking at the occupational health and safety of those who work at the missile bases, and finds that there's not enough sufficient evidence to justify further investigations. So here we have the 1976 Toxic Control Substances Act, the 1994 GAO report, and then 01, 03, and 05 Air Force memos and studies saying, hey, this might be a concern, all of which ultimately don't come to fruition, or everything's deemed as safe and healthy, and so on. And then really, we don't hear about this issue again from the Air Force until last year, after the Malmstrom Initiative slides, which were compiled by a Space Force officer, point out, hey, I went back, and this Space Force officer as well, diagnosed with cancer, says, I have this health diagnosis. I went back and looked and saw all these other cases of cancer among those that have served at Malmstrom Air Force Base in Montana in this career field. I think this is of a concern again. And then that's where we start to see the Air Force respond to this. So we have this very long gap, something that stretches from the 70s, the 90s, the early 2000s until today. And again, to the Air Force's credit, very quickly after those slides started circulating, they commissioned their own long-ranging health study. And so the Air Force is digging into this issue. And the preliminary findings, which really are very small and only encapsulates about 25% of the potentially affected population, has found that there are early indicators that show elevated risks of certain cancers in this. I believe it's breast cancer and prostate cancer. So with that, there's still more work that the Air Force needs to do with this study. And the Air Force has acknowledged that they need to go back and change some things. They need to change how they do exposure reporting with missileers and maintainers who are exposed to these things. It's updating the technical orders for those that are working on the missiles. So we're seeing some gradual change, but I think, and Bill might be able to mirror this as well, but I think that the missileers are more so, why did it have to take this long? Why are we talking decades of these red flags being ignored? It's worth noting that after those slides also went public and they commissioned the health study, they did environmental sampling at the bases. Several of these bases tested positive for PCBs at elevated rates. So it was clear that these substances that have been linked to health concerns and cancer were still present in some capacity, even after these kind of missed red flags that had popped up over the decades.
Thank you, Tom. That unearthing that history seems very, very important, as we continue to see that there is reluctance or has been, to recognize these illnesses as service related. Bill, can you talk about that, please?
Sure. So, as we talk through that, again, from the initiative piece, that was a key piece of our registry, right? Was trying to get out there and figure out, hey, how do we scope that registry? How do we scope, what are we looking for here? That registry really is out there for our veterans to register what their health concerns are, wide ranging. We get questions a lot about, hey, should I put this particular condition on there? Should I put this condition on there? Our answer back to them is, hey, whatever you're willing to share, let's have it. Because again, I think what this really encourages is this culture of sharing that information. So that way we can try and figure out what these causation pieces might be. Because right now I know we have some initial concerns and thoughts. Tom had talked about the PCB thing on there and the exposures with that. But I think we also know too, just given the time frame which these were built and operated, that there could be lots of other dangers possibly lurking in there. We don't know. And I think from a Torchlight perspective, right, we're trying to get that advocacy out there to look into those topics to see what those wide-ranging areas of causation could be. From that. So, again, it goes back to this idea of, trying to take care of our veterans after they've been, potentially exposed to these substances and really trying to help them in their quest to get the healthcare that they need to navigate the VA process, to really help the families as well and support the families and give them resources. Another big piece of what we're trying to do also is helping them get affairs in order for those that have terminal cancers. So helping them write wills, helping them, take care and get all their final affairs in order for the family. That's a really big piece of this as well, because that care goes beyond. So again, really focusing on as a Torchlight initiative, focusing on taking care of those family units, taking care of the survivors as well as the veterans as well, and then advocating for, hey, what's the causation here? The other big piece to this too, I think that can't be understated is really, I think, the need for that preventative care, that preventative diagnosis. If we can catch these things so much sooner, I think we have a much better chance to leverage, all the different elements of our healthcare system to try and help improve quality of life, to defeat the cancers that they may have, new and novel treatments, et cetera. And, I think given some of these histories, we have to really look and say, hey, maybe these screenings need to occur much earlier in their careers. So I think that's a big piece of it. And it's something that's certainly from the initiative perspective that we're really advocating for.
Can both of you talk about what's going on right now? Is there any awareness in Congress and concern about this? What about Air Force leadership?
Yeah, I'm happy to speak to that. So with the Air Force has been, I will say, pretty responsive in this. Air Force Global Strike Command, which oversees America's nuclear missile enterprise, they have been very vocal about this and talking about the studies and the testing. I think the real concern, also just this was very early on, but last year I remember I had the chance to interview the Space Force, the head of the Space Force, the chief of space operations, Chance Saltzman. And General Saltzman himself was a former missileer. And I said, this should be very personal to you. What does this feel like? And his advice was, go get screened. If you have a health concern, don't think about it, go get screened. And so I think what we saw was a fair amount of empathy from some Air Force leaders with this, especially those whose careers intersected in that career field and worked in the missile fields. So we saw some of that response. When it comes to Congress, we saw some initial reaction when this study was going underway and when this issue was getting publicized last year. But we haven't seen a whole lot more. Obviously, we're seeing some response in that, and Bill can talk to this as well, but one of the key problems that exists here is that this is a generational problem. And so diagnosing, hey, did I get sick from my time in the service is not easy. And there have been generations that have passed since some of these veterans have been in uniform. And many of them have not gone through the VA for their health care, for example. They've gone through a private provider. So a lot of them are now going back to the VA, especially under the PACT Act, which passed, the 2022 PACT Act, which opened up kind of more opportunities for service members to come and talk about their toxic exposure with their VA health provider. We still see a lot of service members fighting for those benefits. I think it's being able to point to that link, and that you need to have the receipts, the paperwork. And for so many of them, it wasn't documented, or their exposure was not, they didn't have that paper trail. So I think we're seeing that fight. I know the Torchlight Initiative has written a letter to the VA pushing for some change on this. The VA has responded that they're looking into that. But I don't think we're seeing a whole lot of congressional response to whether it's VA reform or more Air Force reforms on this issue.
Bill?
Yeah, I'd like to add on there and just piggyback on some of Tom's comments there. I think from a military leadership perspective, I think we are seeing some very good traction on that. I think there's a lot of credit due to Air Force Global Strike Command, General Bustier, who's in charge of the command, really being very proactive, being very forward, being very transparent with what efforts they're undergoing as far as the study goes for that. So we're very, very encouraged from a Torchlight perspective for that study, and look forward to those studies and the results of those. We're also engaging too with other studies that are out there as well. And I think that the big takeaway from a lot of this is, again, encouraging with folks who are part of the Torchlight, reaching out within our missile community, making sure that there's active engagement out there. I think that one of our greatest fears from a Torchlight perspective is that we have folks that might be out there that don't know about this, that may be suffering in silence. They may not know the resources that are available to them. So we have our resources linked on our website at torchlightinitiative.org. And we encourage folks to take a look at those resources, because we have a lot of great useful information. There's also a contact piece in there as well, where those folks can reach out to us at the Torchlight for any questions that they might have, or if they need some support. So we have that built into the website on that as well. So, as we look forward to different, test results coming forward, that's really a big piece of it. Figuring out what the causation pieces are for that. That to us is really the most important thing, because once we can figure out, is there a problem? Is it linked to potential toxic exposures? Now we can start identifying causation, and we can start figuring out, how do I mitigate those things? How do I, how do I treat them? How do I protect them? Things of that nature. So I think that's a really big piece for us at the Torchlight Initiative, is advocating for those things, and then also educating the community about it, and serving as a panel of folks that can be the voice for those out there who might be suffering. And then again, actively encouraging folks to be participating in the conversation, to be actively engaged, to know that we're out here, we have resources available to them, and we can help them so they don't have to struggle alone.
Yeah, that's really interesting. I think many people in the civilian communities don't understand that vets have to make arguments. I mean, some people remember the Agent Orange experience, burn pits more recently, but it is true, people have to pursue individually. And I guess I'm wondering, are you trying to urge more of a kind of a group recognition, so people don't have to go through this individually, where there might be some, an institution of early screenings, like the general suggested, go get screened?
Absolutely. No, I think you're right. I think it's really a multi-pronged approach. I think it really does start with the studies, right? To figure out, hey, what does the data show? Let's take a look at that very objectively, very transparently, figuring out what does the data indicate and show. There we can, if it shows that there are significant issues with the population, which we believe there are, now we can start looking at causation for that, right? We can engage the medical community, for that causation, and try and figure out what those pieces are. And then, once we have that part of it, now we can start, going for the care and support and the benefits, and we can go to the VA. We can connect it to the service piece on that. I think that's what's been difficult right now for a lot of our folks who are suffering is establishing that service connection. So Tom had mentioned that we had sent a letter up to the VA about that, trying to establish that service connection, about inclusion into the PACT Act. So that's a big piece of it. But again, we'll need that data for that. But again, I think that the groundswell has shown that there's some pretty significant indicators out there. So, but most importantly, I think it goes back down to that pre-screening piece above all else, that we need to figure out how to catch this stuff very early so we can help our folks navigate the healthcare challenges. I'll share with you just a quick story too, something that just happened last week here at the initiative. Again, we're dealing with a very difficult topic, a very sad topic, and stuff that's really challenging. But kind of a bright spot, I think, for us that we talked about just recently, we had a member come forward who had heard about the initiative, who had heard about what we were doing, and had questions, and had just recently been diagnosed with cancer. And so for that individual to reach out to us and get in contact right away with us, I think was a huge win. It certainly made us feel good in the initiative that we were able to provide the support to that individual. We were able to point them in the direction of, hey, here are some of the things you need to look at. Here are some of the tests that you might need to ask your doctor about. Let me get you in touch with someone else who has suffered from a similar condition or is suffering with that right now. Or let's get your families connected so that way you can connect at that level of support. So I think for us, that becomes a huge piece of what we do. It really becomes a big part of our why on that, in addition to those advocacy pieces and trying to find causation. But really at the end of the day, it's really all about us trying to help solve this problem with the rest of the community, to include the military side, to include the healthcare side, the VA, so that way we can figure out what's causing these things and hopefully alleviate some of the suffering.
And to add to what Bill said too quickly is just that some of the Air Force reforms that we've seen are things that missileers and maintainers wish would have been in place during their service, but things that we've seen happen just over the last couple months, even during the course of our reporting on this topic. For example, the Missileer work site and the launch control centers are now going to actually get very thorough occupational reviews now. Like they're going to actually scrutinize those like they have been scrutinizing where the missile itself is housed and those who are maintaining and working with it, right? A very basic common sense thing that a lot of missileers are like, well, why wasn't this taking place 2 decades ago or 3 decades ago for that matter? We see now that there's going to be new workplace tracking in place for exposures for missileers, things that will help when they leave the service. And if they do find out that they are getting sick, they'll have more of those receipts that exist where they can take that to their VA provider, and hopefully there'll be some change. But these are all changes that have happened within the last couple months over the course of our reporting, over the course of the Torchlight Initiative, making this issue known to more people. And they're small common sense things because a big part of this story is also the cultural change. I can't tell you how many missileers and maintainers I spoke with that worked in the 80s or the 90s who talked about if there was a carcinogen leak or a toxic leak of some kind in the launch control center, they would just clean it up. No gloves, no personal protective equipment, and that immediately puts them at risk. They would talk about supervisors who were rushing to get jobs done because it is a 24/7 career field, and they weren't as concerned about possible exposure. I had one maintainer who spoke with me who recently left the service who talked about his concern that when he opened up the personal protective equipment kit to do maintenance on the missiles, that it looked like it hadn't been washed or it had been reused in some way when he thought it should be a single-use personal protective equipment, gloves and visor and such. And these are just those anecdotal examples of past cultural things that were just stagnant in the culture when it came to occupational safety and risks. And so I think what we're seeing now with these reforms, outside of just more screening, more testing, environmental studies, is we're seeing a culture more focused on occupational health and safety over the last couple months as this issue has been brought to light by reporting and organizations like Torchlight.
That's really
Tom,
good
just
to
to
hear.
piggyback on that too, I would say I think you hit on a really important piece of that, which is that documentation piece. And I think what that really also underscores too, and something that we're also advocating is just continued engagement with your doctors, right, with the medical community, with the VA on those concerns. We certainly don't want a culture of folks suffering without that kind of care. We have the care available, and I think one of the big pushes for us at the initiative is trying to open up that care, to open up a lot more resources for that care. But nonetheless, having folks have those active engagements and conversations with their medical team is really, really a crucial piece of this. We don't want to wait until it's way further down the road, because we may have missed options for treatment. We may have missed options to improve quality of life, or possibly even to defeat some of the illnesses that they may have.
That's really good to hear. Very important. Tom, I think in an age when journalists aren't trusted a lot, I'd like you to talk about your process of reporting this, and your use of the Freedom of Information Act to obtain information, and your engagement with the community of missileers to hear out their stories.
Yeah, absolutely. Um, just as a quick pitch, like military.com is such a fantastic news organization. I'm glad that they give us the bandwidth to report on these stories because um, while a lot of defense and military publications are focused on the technology or the industry, we are heavily focused on people. And I think people are the key element to the work that we do and to the watchdog journalism that we provide. So I think what made this story so important was one, we wanted to get the receipts, we wanted to get the documentation, and two, we just needed to hear what the reality was like for missileers and maintainers in the field, and the two were linked in that sense. So we used the Freedom of Information Act to get copies of the previous occupational health studies that were done when these cancer concerns were brought up in the 2000s, in the early 2000s. So we were able to get that study through the Freedom of Information Act, allowed us to look at what some of the shortcomings were, what were some of the risk factors that were identified. So we had that piece of evidence, which was super helpful. The people aspect to this is the military is a tight-knit community. This is a tight-knit community within that tight-knit community, doing something that is a highly classified job, something that is very intense. Anybody who's been a missileer or a maintainer will tell you how stressful it is because America is constantly on alert with its nuclear missiles. And this community was very concerned about these ongoing health risks. So when we put a call out to the Torchlight Initiative and some other organizations to try to connect with these veterans, I wasn't sure, if they would be trustworthy. Would they trust a reporter with their health story, with their information, to understand the culture that they're coming from? So it helps that military.com is focused on people and that we were able to dive into what the career field is because Torchlight, for example, was able to connect us with veterans who had been sick, and they were able to very much so open up their hearts and open up their homes to us to let us in and talk to us about this issue. And with that, with their stories, some of them were absolutely heartbreaking. There was one story of a missileer who has not gotten sick, but because of this, feels like he's become a hypochondriac and also carries so much guilt because his young son has now joined that career field. And he wants to make sure that his son is going to be treated well and not have to worry about potential cancer one day or health concerns one day. And so all these people helped us realize, we need to see where the other warning signs were. So talking to veterans from the 2000s, they mentioned the prior studies and we were able to find it. Some of them provided us with their own health records, which allowed us to help. Torchlight on their website has resources for veterans, which includes some of the past studies that had been done, like the 1994 Government Accountability Office report, which allowed us to see some of the warning flags that the military services had raised in the past. And there had been some small reporting on this from other outlets when the issue came kind of out last year. But what we wanted to do is we wanted to tell, and I told every source that we spoke with about this, we wanted to tell the most people focused story possible, because we wanted to talk about, why does this issue truly matter to you and your families? And whether it was the widow of someone who the widow of a missileer who's fighting for death benefits and compensation benefits for her family, whether it was an old maintainer who worked in the 1980s who's been diagnosed with prostate cancer, who's trying to get answers with his doctor and his VA provider on what could have caused this, right? That openness to share their health story with us was so important. And I'm glad they put that trust within us, because what we wanted to show was that we had done our homework, that we knew what the issue was that they were talking about and the culture that they were coming from. We were able to, by speaking to so many voices, understand that it was a high, and also we went there for what it's worth too. Because of the support we had, we were able to travel to F.E. Warren Air Force Base in Wyoming. I was able to go 60 feet under the ground to speak with missileers who were doing the job on alert. So we were able to paint that vivid picture of, this is the work environment that they're in. We were able to be out in the frigid American West to explain that this is a job. And this is one point I'll make too, is that this job, even with those that I've spoken with who have had diagnoses that are scary and life-altering, I have not spoken to a single missileer or a single maintainer who regrets their service. Every single one of them was passionate about serving their country. And what they were disappointed in was the lack of transparency or the lack of a safety culture that could have made them prevent this. But so many people, one of the questions I would ask during my interview after they share a heart-wrenching story of their diagnosis was, if you could go back, would you not have done this job? And every single one of them said they were proud to serve their country, and they were proud to be a veteran and a missileer and a former maintainer. So I think what we found was a very patriotic group of Americans who felt slighted by the lack of transparency. And so the trust they put in us was that we were bringing those issues to light. And I think as a result of that, they were willing to open their doors and their hearts to us.
Yeah, and
Thank
I'll
you,
add in
Tom.
too, Tom, on that as well, if I could, Susan. I think you're absolutely right. As a former missileer myself, very, very proud of my service as a career officer, very proud of my service to our country. And I think you find that, Tom, you had mentioned it with all your interviews, and we see that over and over again within our community and the military writ large, I believe. But as we talk through that, I think that also, is something that we're also trying to harness with the initiative. We're trying to harness that sense of community. We're trying to harness that sense of pride in what we did, and also too, let everyone know as a veteran community, hey, it's okay to ask for help. It's okay. We're here to help you. There's lots of resources that are out there. You don't have to do this alone. We are there to walk side by side with you on your journey. Wherever that journey takes you. And I think that piece is very, very reassuring, not only to the veterans, but also to the family members as well. So we're here for them as well. And we're not going to leave their side. So, from a Torchlight perspective, I like to think that that's some of the symbology that we have with our symbol being a torchlight, right? Of, hey, follow us, follow me. We're going to illuminate the way forward for you, and we're going to walk with you on that pathway as we move forward. So that's a huge piece of what we do. Again, very people-centric on that, and really a core part of our mission set.
Well, it's really great that the First Amendment can help out with this initiative. If anybody has any questions, we're short on time now, but if there's something else you want to ask, please do. We do have a question from a Dr. Rob Calderon. You've answered this to some degree, but maybe you can add. He asks, has any of this information led to changes in current missile field to try to prevent new cases? You've addressed this, but maybe you want to add something.
No, totally. I'm happy to answer that question again and kind of summarize some of the big changes that have happened. So there is the ongoing study, of course. Something that was kind of buried, I think, in the news releases about this ongoing study were some of these small changes that may seem small but have a big effect. And I pointed out a few of them, some of those being updated technical orders for those who are working on nuclear missiles. So the technical orders are these giant, thick binders, massive binders that young enlisted airmen have to flip through anytime there's a component to fix on a nuclear missile. And within those, it sometimes has not properly labeled or identified or explained the steps to what to do, what you should do if you encounter toxic substances in some way. So they're planning to update some of those technical orders. They're putting new plans in place to remediate PCBs and some other carcinogens within the launch control centers and the missile silos themselves. There's new workplace tracking for tracking those exposure risks and some more inspections happening. So these are all some small changes that have happened. But, I think like we've talked about during this, the bigger changes we need to see are more frequent screenings. And also really, the big question is eventually the intercontinental ballistic missiles themselves are going to be updated to a new program called the Sentinel program. This is something that's been in development for a while now. It's wildly over budget, 81% over budget right now. And they are claiming that there will be new occupational health standards put in place with this new program. And that'll be some of our next follow-up reporting at military.com is following up and getting hopefully some answers on what that actually looks like. But that's one of the things that at least Air Force officials are claiming will help prevent new cases. But we're obviously going to do our job at military.com and follow the evidence on that and see if that's actually the case.
And I think from a Torchlight perspective too, we want to make sure that those studies, we get those studies completed, so we can learn the lessons from them. If there's great lessons to learn, so we can transfer those to future systems, even export them to different career fields that are out there for that. So again, this becomes really a big discussion about information sharing, about being very, very transparent about, hey, what are the dangers out there? How do we remediate them? And then how do we move forward in the future to hopefully prevent more illnesses out there? But again, I think it just goes back to that community connection. And from the initiative too, we are actively asking folks to make sure that they're engaged with their medical community, that they're actively engaged also with some of the town halls that have been out there that Air Force Global Strike Command has been putting on, which is a fantastic step for transparency. So, but being active in all those discussions is a really important part, I think, for us as a community.
Tom, you just wrote a story on the 15th. That's somewhat of an update. There's a new study, non-military study, correct? That's relevant.
Correct. This was actually one that was put on by Torchlight. Perhaps Bill can speak a little bit more to it, but we received a copy of that, and it was some statistical analysis done on their registry, which is they've done a self-reported cancer registry that has looked at the longstanding illnesses that may have occurred in the career fields with that. And so there was some statistical analysis that was done that Bill could perhaps speak to.
Sure. So not prepared to speak to the details on the actual study itself, but just to let everyone know that we do expect that study to be coming out here in the next couple of weeks, which we think will, establish that, the chances of this happening just in nature, coincidentally, are extremely low. So we do expect that to be coming forward with all the details on that, with the academic rigor behind all that on those studies. One other piece that I'd like to also hit on too, we talk a lot about the missileer piece on this one, but all the comments, all the things that we talked about from an initiative standpoint also include the broader community of support that was out there. I mentioned at the beginning of this webinar, but we have folks who guarded the missiles and the facilities, the security forces folks, we have the maintainers, we have the support personnel, folks that are all out there. They're all absolutely welcome to share their stories with the Torchlight Initiative, to share their stories with the community, to register on the registry with any health concerns that they might have to help with some of that body of work and body of knowledge. And again, just that active engagement, is such a key piece to what we're trying to do on that. And just knowing that there's tons of support out there.
Great. I want to thank Bill and Tom for joining us. This has been an excellent conversation, sobering, but also helpful. It's great to see light on this subject. And I'd like to invite you all to look at Tom's reporting on the Pulitzer website or military.com so you can follow it. And in closing, I'd like to also invite you to look at a new story that is on our website that was just published by Rolling Stone that is about battlefield superbugs, antimicrobial resistance, and how wounds are spreading these infections, which are very dangerous globally. It's a very interesting story. The reporter is a doctor. He went to Ukraine and talked to wounded soldiers, and he also talked to U.S. veterans that and their families about this problem. So thank you all for joining us, and hopefully you'll come to more of our webinars.